Hello, everyone. I'm Dr. Brooke Friedman, and it's really a pleasure to be able to chat with Anna Buxton today. I'm one of the reproductive endocrinologists and infertility specialists at San Diego Fertility Center. And at SDFC, we are really honored to help patients, not only in the United States, but around the world, build their families. And one of the ways that we are able to help patients build their families is through surrogacy. And that's what we're going to be talking about today. Like I said, I'm very fortunate to be joined by Anna Buxton today, mother of 3, of daughter Isla, who is 5, and twins Olive and Art, who are 2. I was very fortunate to be able to take care of Anna during her journey to conceive Olive and Art, and we're going to be talking a little bit about that today. So Anna, hello, and it is so good to see you.
Hi, so good to see you too.
I do wish we could be here in person, but even if we were in the same city, I'm in San Diego and you're over in the UK, but even if we were here, we wouldn't really be able to be close given that we're all social distancing. So I guess we're stuck with online for now. Yeah. Well, I can't believe the twins are 2.
I know it is crazy. It's I know it's such a cliche and everyone says it, but it's just gone so quickly, and they've suddenly gone from babies to proper toddlers with tantrums. So it's fun times here. But there's
I bet you have your hands full.
Yeah, at the moment, yeah.
Well, do you want to share a little bit about your journey and kind of what led you to, surrogacy and then SDFC later down the road, and kind of what your experience has been?
So, as you said, so we have Ed and I, my husband and I have 3 children. Isla, who's 5, and then the twins are 2. All of our children were born with the help of a surrogate. When Ed and I first started trying for children, I had 2 miscarriages, which were missed miscarriages. And the sort of subsequent management of my miscarriages meant that I was diagnosed with something called Ashaman Syndrome, which obviously you know about, but it's adhesions or scarring in the womb, which mean that you can't carry a pregnancy. So we were told quite quickly after my miscarriages that I wouldn't be able to carry a pregnancy, and so for us, surrogacy was a really natural next step for us, given that I did have viable eggs and I had viable sperm, but just that we couldn't carry. So when we started looking and thinking about surrogacy in the UK, India, where Isla was born, was our first choice. It was just at that time a really well-trodden path of British couples, and it made sense for us, and it worked. And 5 years ago, Isla was born, and it was wonderful. And I still pinch myself about it. But when we decided to have siblings for Isla, or when we knew we wanted siblings, India was no longer an option because they didn't allow foreigners to have surrogate children in India. So we started looking elsewhere, and it's very difficult in the UK for many reasons. And we thought about Canada, we thought about the US, and I won't go into the long story. It took 3 years of unsuccessful relationships with doctors, unsuccessful relationships with different agencies. We had a lot of disappointment over 3 years trying for the twins, and by the time we got to a point where we decided we had one last chance, and at that point we felt we really needed to give ourselves the best chance possible. So we decided to come to the US. Given how well established surrogacy is in the US, the legal framework, and also the quality of medicine. And added to that, we always like the idea of California, again because of the legal framework and just the number of surrogates in California. So a really nice place to be. So I did a lot of research about the people, the process, clinics, and quite quickly SDFC came up as being a really good IVF clinic, but also really experienced in surrogacy and international surrogacy. And so did a few other clinics as well. So I decided to pick 3 clinics, and I had initial consultations with all 3 clinics. And that's when I met you for the first time, or over the phone.
Yeah. And I think that initial consultation is so important. And we always try to put ourselves in the patient's shoes. When you're so far away geographically, it is quite a leap of faith to think, okay, I'm going to be starting this treatment and then traveling, to a faraway destination for care. So that has to be nerve-wracking in the beginning, I would imagine.
It's a really funny thing, because I'd personally been through IVF before, so I sort of thought I knew about it, but every clinic, every doctor has a slightly different way of doing things. And you want to feel listened to, and you don't want to feel like you're just sort of another cog in a sort of IVF wheel. So you really need to feel that you're talking to a doctor who understands you, your goals, your history, sort of how far you can be pushed or not pushed, and lots of different factors. And I think for me, that's when I first spoke to you, I knew that you listened to me, and that really was sort of what I wanted. And absolutely, you need to go to a clinic who has amazing successful results, and results in terms of IVF, and also experience within surrogacy. But for me, it was having someone, as I said, who listened, and I felt listened to. And another thing, one of the things I always remember about when I spoke to you is that you gave me your number and you gave me your email, and you said, if you've got any problems, just email me and I'll give you a chat. And actually having that immediate contact with someone again was lovely, because often you have to go through lots of people. So we chatted, and we made the decision to come to San Diego Fertility Center.
And we are so honored and glad that you did. I think for us, it's true. We understand it's so hard when you're far away. So we really want everyone, and I'm glad that you felt that way, for all of our patients to feel like they have direct access to their physician, to their whole team, to their nurse, because it is this leap of faith, and we feel that it's an honor and a privilege to help care for people, and for people who are not only here but abroad. We feel like it's so important for you to be able to get a hold of us and answer questions. And for us,
I guess one of the other things I really thought about, and this had sort of stemmed from some mistakes we'd made in the past, was that not only when you're picking a doctor for IVF and surrogacy, are you looking for the best care for yourself and for your IVF, but also you want to be sure that the clinic you're working with, number one, only allows women to be surrogates if they should be surrogates, if it's safe for them, and also that once they're pregnant or during their protocols, that they're going to be looked after. It's such an enormous ask to ask someone to be your surrogate. You need to know that they're being looked after, especially when you're thousands of miles away. I just remember Holly, our surrogate, going to the doctor thinking, at least I know she's in safe hands. So I think it's always, with surrogacy, it's got to be you've got to think about yourself and your IVF, but also your surrogate, and is she going to be a good surrogate, and then is she going to be looked after?
Absolutely. I think, Anna, we might be frozen a bit, but I can hear you, so maybe we'll continue, and hopefully we'll unfreeze a bit. Perfect. Okay, we're back. I mean, I think as fertility doctors, we really think about it as we have two patients, right? We have our intended parents who are going through this journey to build their family through IVF and through surrogacy, and then we have the surrogate. And as you said, it's such a tremendous gift that these surrogates are giving. We really want to make sure that we're, well, first and foremost, evaluating the surrogate to make sure she's healthy and an appropriate medical candidate to move forward. And we can talk, that's step one, obviously. And then step two, like you said, really helping do really comprehensive medical screening to make sure we're not missing anything, and doing everything we can, not only to optimize success rates, but to keep the surrogate as healthy and safe as possible. So I think absolutely that's really critical. And I think, as you know, I mean, we're being independent from all the different surrogacy agencies. We work with all of them, but we like being independent because we really see our role as being an advocate for you as the intended parent, and then also for the surrogate, to be sure that we're not missing anything, and we're helping intended parents find the best surrogate, and then supporting the surrogate too. So yeah, and you had such a wonderful relationship with Holly, your surrogate, which was really special.
We did, and again, I think for us that just came down to communication.
Yeah.
In that we communicated a lot, and also again, I think I sound like a cliche and I keep saying the same thing, but as you need to trust your doctor, you need to trust your surrogate, and she needs to trust you. We just trust each other, that I trusted her that she was looking after herself like she looked after herself with her own children. And I never stipulated too much, I just trusted her, and then in return she sort of, I guess, sort of believed that we were really wanted to be parents, and she was so happy to be doing what she was doing. So yeah, we were really fortunate. But then I speak to so many people who have equally wonderful relationships with their surrogate, and it just comes down to just being able to talk to each other.
Yeah, and I think you can probably speak to this a bit, but in other countries around the world where compensated surrogacy is not legal, sometimes I get a lot of questions of, well, how does the surrogates feel, or patients are concerned about the worries about exploitation, and that's one of the arguments we hear sort of against compensated surrogacy. Our experience as doctors caring for these women is they feel so empowered and positive about being able to help other people build their families, that they feel it's far from being exploited. They feel really empowered, and it's something they feel really good about being able to help. And so I think sounds like a little bit what you had experienced as well.
I always remember Holly saying to me that she didn't feel that she could sit back as a devoted mother of three, knowing that other women couldn't have children, and that she could do something about it. And she felt it was sort of just something that if you can help people, why not? And it's obviously not for everyone. It's an amazing sacrifice to be a surrogate.
Absolutely.
But for some women, it is also an amazing thing to do, and they love it, and rightly so, feel incredibly proud of themselves, and that's how Holly feels, as do her 3 children, who think that she is an angel, and that's what she is to us. So
yeah, that's really special. And your whole journey was pretty quick, because we first met in May 2017, and then we were transferring embryos to Holly in October.
Yeah,
2017. That was pretty quick.
It was really quick.
Which is wonderful. And I think for people who might be listening, and just because the process, I think at the outset can feel quite daunting, understandably, as looking at it as a piece of everything together. But I think it's helpful a little bit to think of it in that stepwise approach of, okay, first, if you're a patient who is planning on creating embryos to transfer to a surrogate, focusing first on, okay, well, how would I accomplish an IVF cycle? Like if I don't live in San Diego, how does that happen? And I think you can speak to that a little bit more, but just from the medical side, it works quite well from our perspective. So many of our patients come to us from around the world. We have these really great working relationships with clinics around the world, so that I can send orders to a clinic perhaps in the UK or somewhere else saying, can you please do an ultrasound and blood work for this patient? And then they can send us the results, so we can manage things from afar until you get here a little closer to the time of the egg retrieval. And once you're starting those injections and then retrieve the eggs, create the embryos. And that, thinking of it as, okay, step 1, let's make embryos. And then step 2 is ICP, which is a whole other piece, I think it can be a little bit helpful. How was your experience kind of with that from afar and then coming here? I know it moved pretty quickly for you guys.
It did happen quickly, and that is, I know, not always.
Did I lost you for a second? I think we're back.
We're back. We're freezing again. I can hear you.
That's okay. I can hear you too. I can hear you too.
So for us, so we, after we had our initial consultation, we then sort of moved into the planning, the IVF stage. And as you said, you worked with a clinic here in London. And again, it feels very strange, a doctor you've never met, thousands of miles away, sort of prescribing medication. But the fact that you can work with a clinic in your home. Can you hear me, Brooke? We've frozen again.
Am I frozen?
Frozen. I'll keep talking.
Am I? I can hear you. Okay, you keep talking. Well, I can hear you. Can you hear me, Anna?
Yeah, I can hear you. So so the fact that we could work with
you keep talking.
Okay. The fact that we
okay, perfect. Yes. I can hear you as well. So
okay. It must be me. So we worked with this clinic in London, and that worked really well. We decided to come out to San Diego relatively early in our cycle, I think it was, or in our, I think we came in about day 7. So I'd done a week in the UK and then flew out. And I think that was because I just felt the need to sort of be in situ and meet you and meet the team at in San Diego. So we flew out and then carried on with the sort of daily or every other day appointments and bloods and scans until it was time for collection. And it is weird, and IVF is hard, but it worked, and I think it worked as well as it could have. And definitely being able to go for a walk on the beach after my appointment with guys was really nice. Very sort of peaceful, cathartic
San
place to be.
Diego's not a bad place. It's not a bad place to be. You know, I have to tell you, I have really fond memories of Isla and Ed, and Isla coloring in the waiting room and pictures and stuff. So she would do artwork. And there's a chance I know that she got to go to the zoo and do some fun things when she was here. And so
it definitely made the most of it. And then we I think we stayed then for a few days after the collection, and then home. We were lucky in that we were able to also meet Holly when we came over to the IVF. So we met her and her husband and her 3 children and met Ed and Isla. So that was lovely. It's not always possible for people, but if it is possible, it's lovely to do that. And then November, October, you did the transfer.
And we were so happy that it worked, and that Holly did a great job carrying the twins, and I can't believe how time flies and that they're 2. I remember when you brought Olive and Art by, and they were just little peanuts before you flew home, and now I can't believe they're 2 years old.
I know.
That's the best part. That's the best part for us, honestly, when we get to meet the babies. That truly is really special, really, really special for us. And I think now, we know that infertility and struggling to conceive can be an isolating experience. And now, especially with COVID-19, I think people are physically isolated too. So it really sort of compounds, I think, what can already be a struggle. So I just wanted to speak to that for people who might be listening and going through what we know is a difficult time. I think right now it can feel even potentially more overwhelming. So I think right now more than ever, I think it's an important time to gather information and for people to try to care for themselves. And if they're having a hard time, like reach out to maybe someone who's been through it. And we're always happy to answer questions, but really to realize that people aren't alone and that it's very common to struggle sometimes to build a family. And there's a lot of different ways to building a family. But I think that first step is really is knowledge is power, gathering information. So if people are thinking, well, is this an option for me? Could this be a way for us to build our family? To have a consultation with a physician, and that is a really important time to take a history, go through everything, really understand that patient's family building goals to see, well, what are the options? you know, and I think sometimes what we found, and I don't know if you felt this way, is sometimes that first step is the hardest. It's like saying, well, it's a little scary to make that appointment and to say, well, is this even something I can consider, or is it right for me? But I think at least gathering that information, you're empowered to figure out, well, what are the best next steps for me? You know, I think that would be my piece of advice for that.
Yeah. And I think because for most women who are coming to IVF and then maybe surrogacy, it's not a definite, you have to do IVF, or you have to do surrogacy.
Right.
This is going to enhance your success rates, and so making that first step to IVF and surrogacy, it does feel in a little bit like you're saying goodbye to something. You're saying goodbye to of carrying your own child, or conceiving in a traditional way. So it is so hard making that step, and that's why I always say to people, it is just talk to people who've been through it, talk to doctors, just gather information, because until you have all the information, it's even harder to make a decision. I guess, Brooke, because I have spoken to a few couples or met people who pre-COVID were, kind of at the beginning of their journey, thinking about, what to do, whether to come to the US, or had got to the point where they'd had blood tests and protocols were being set, and they were about to sort of start a cycle. And then obviously, who would have thought this would have happened? What do people do now?
Yeah, it's a good question, and it's also a little bit tricky just because it's such a moving target right now. Everything's in a bit in flux. So what's true today may not be true in a week or a month. But we are really working closely with some of the local clinics abroad and in Europe and around the world. And in some cases, like we have certain clinics that are able to freeze sperm and ship sperm to us if someone's proceeding with an egg donation cycle. For patients who are doing IVF with their own eggs, we're having COVID testing when they arrive, and sort of have a more brief period of quarantine prior to coming to the clinic, but trying to do everything that's to maximize patient and staff safety, but try to do whatever we can to minimize the burden of sort of that quarantine time on either side. So we have some protocols in place for COVID testing and things to try to help support our patients if they do feel comfortable traveling. And I think what's important to know is there's never been a case of viral transmission of any kind, but really particularly of COVID to embryos. So if patients are thinking of moving forward with an IVF cycle with their own eggs or egg donation, we are open, we are moving forward with that. A lot of our patients, because this is such a time-sensitive journey, very much want to move forward with that next step of transfer. And we have other patients that say, well, I want to freeze embryos and then pause for a moment, kind of reevaluate. But certainly we are open, we're doing cycles, and a lot of our partners around the world at clinics are helping us do ultrasounds and that testing. But we're certainly available for physician consultation, because there's so many questions, right? There's so many questions. I think the best way is just really for us to be able to try to answer them one-on-one, because each person's situation is going to be different. But we want to do everything we can to help people move forward, because we know, especially as you said, people who are on the verge of moving forward, we really want to do everything we can to help them move forward if they feel comfortable doing so. At this point. I know.
I always just love you sort of saying about that everyone is so different, and that is the thing. It's finding people, talking to other people who've been through it, because it is invaluable to talk to other people, but also everyone is a little bit different. So it is then finding the right doctor to talk to who appreciates, all the nuances of your individual case.
Absolutely. I mean, there isn't one treatment plan. It's really coming up with that individualized plan, because everyone's journey has been different. And usually by the time someone comes to talk to me, it's already been a long journey, and then it's a question of, well, how do we support that person in moving forward, understanding it's not going to be easy, but doing everything we can to lighten that load a little bit to make it as easy as it can be. And I think, like, as you say, just making sure someone feels comfortable and can get their questions answered. So, Oh, so good to see you, Anna. Thank you so much for making the time to chat. I wish we could
No,
see each other in person.
always so nice to chat. I know Isla today was saying, when are we going to San Diego? I want to be
I
back
know, I wish.
there. As soon as we can, we will be back on
I
the
know,
beach.
I
Great to come.
know. Well, it's always such a pleasure to get to see you and Ed when we're in London, and we really look forward to hopefully the day where it's safer for everyone to
Yeah,
travel with ease, and so we could see you in person. But I really appreciate you sharing your experience, and I know other patients have
so
find it
nice
really helpful.
so nice
Yeah,
to chat.
yeah, it was great seeing you, Anna. Okay, be well, take care. Okay,
Bye.
bye bye.